Every year in the United States, more than 11,000 women are diagnosed with cervical cancer. Thankfully, cervical cancer is one of the more treatable forms of the disease. Early detection is a main reason cervical cancer doesn't cause more deaths. A new member of the Rutland Regional Medical Center's Women's Health Clinic spent time with Access last week to discuss the disease and why timely screenings are crucial.
There's been a lot of changes in the recommendations for cervical cancer screening, and I think that this sometimes causes a lot of confusion, and maybe people might think it's not as important, but it certainly does remain to be a very important part of women's health care.
There are two types of tests used for cervical cancer screening: the Pap test, which is used to find early cell changes, and the HPV test, which can find infections that can eventually lead to cell changes and cancer.
There are over 11,000 new cases of cervical cancer detected each year. But over 4,000 women will die of cervical cancer each year. So this remains, a very big health problem.
The good news for most diagnosed with cervical cancer early: there are many treatment options to wipe out the disease before it spreads.
The good news is that because we screen widely in the United States, over the last 30 years, we've seen our rates of cervical cancer decrease by 50%. So it is effective, and we know that. The other good thing is that when cervical cancer is caught early, there's over a 90% cure rate. So women shouldn't be afraid to come in and get screened, because if we do find something in the early stages, chances are they do really well.
Problems arise when women wait to be screened. Dr. Wawrzycki says 60% of those diagnosed with advanced cervical cancer is because of inadequate early screening.
So screening should start at age 21, and that did change a few years ago. They used to have a recommendation for screening 3 years after the onset of sexual activity, and now it's age 21 regardless of sexual activity.
There are changes women should be aware of with their bodies in relation to the disease.
In terms of cervical cancer, having any sort of irregular bleeding, especially spotting after intercourse, can be a red flag that something's going on. And cancer in more advanced stages can cause urinary obstruction and symptoms of that nature.
Cervical cancer's other cause is the human papillomavirus. Next week on Access, Dr. Wawrzycki is back to talk with us about HPV and why it's crucial for both boys and girls to get the vaccine.